since 2007. From a concerning 580 deaths per 100,000 live births, it's dropped to 301 in 2021. That is a positive trend, but let's not sugarcoat it. It's still a long way from the SDG target of 70 deaths per 100,000 live births by 2030. One encouraging aspect is 109 per 100,000 live births, and projections suggest it could reach 62 by 2024. While this doesn't paint the entire picture, it showcases this healthcare system. Now let's shift gears and zoom in on another important target, 3.1.2, proportion of births attended by skilled health personnel. This tells us how many women give birth with a trained professional like a doctor or midwife present. Why is this crucial? Skilled attendants can manage complications, prevent infections, and ensure safe delivery for both mother and child. The good news is Ghana saw an initial climb in skilled birth coverage from 55.5% in 2016 to 59.1% in 2019. This is progress. However, it dipped to 58.7% in 2020 raises concerns. Unfortunately, the COVID-19 pandemic played a role, with some expecting mothers fearing infection at health facilities. Now let's look beyond just delivery. Antenatal care, postnatal care, and early access to health care during pregnancy are also essential for healthy mothers and babies. While there were slight increases in mothers attending at least 4 antenatal visits and receiving early postnatal care, improvements are needed. One positive trend is the reversal of a declining first antenatal care visit rate since 2016. This shows growing awareness of the importance of early engagement with healthcare during pregnancy. Additionally, increased postnatal care is commendable, likely due to community education efforts emphasizing its necessity. Now let's turn our attention to another critical piece of SDG 3, protecting the lives of young children. This brings us to indicator 3.2.1, under 5 mortality rates. This number tells us how many children sadly die before reaching their 5th birthday. It's heart-wrenching, but understanding it is crucial for improving child health in Ghana. There's positive news here. Ghana has seen a consistent decrease in under 5 mortality since 2013, from 111 per 1,000 live births. Then it dropped to 56 per 1,000 in 2017, and even facility-level data shows a downward trend between 2019 and 2021. This signifies a 3% average annual decline within healthcare facilities. Beyond overall
Hello, good afternoon, and welcome back from our delicious and healthy NCD prevention food. Well, I don't know if somebody wants to give a few remarks or 1 or 2. Is the food okay? Does it look better health related, food? Does it look healthy enough? I guess so, because I saw people taking it of, apples and here and there. Right, so the next on our agenda is a panel discussion. And we're supposed to have had one of our key partners joining us online. Unfortunately, he went off. If he comes back, we would give him the opportunity to share with us some few, some few stuff before we end the meeting. But otherwise, I would like to call on the stage some few individuals, experts, who would help us to respond to some few questions related to health and health-related SDGs as far as our country is concerned. So I have the number one person, who is Mr. Joshua Eddy, or Addy, from the National Council on Persons with Disability. If he's around, can he take the floor? Can he take his seat? Yes, let's give him a moment as they walk him to the. If he can take the first seat, yeah, the one over there. Next is Miss Margaret Imprim. Please, this name, yeah, is it correct? Imprim. Okay, great. So she's the Green Africa Youth Organization representative. She's also worked with the National Youth Action Group on Climate Change. And then we have the next on our panel is Dr. Marion Oko-Owusu, Director of Family Health Division, Ghana Health Service. There's Ghana Health Service. Thank you. Yes. Thank you very much. And then the next is Dr. Sophia Kisiwa Ampofo Kusi. She is the Policy Planning, Monitoring, and Evaluation Division and Health Planner, Ghana Health Service. Okay, she says she's not a doctor, so she's Mrs. Sophia Kisiwa. She's just representing her director. Yes, so thank you very much. I believe we are balancing the gender. And then now we have Mr. Ni Odotei. He's a principal planning analyst, National Development Planning Commission. He's also a principal planning analyst, National Development Planning Commission. Yes, so can you give them a round of applause? Right, and of course, I have the honors again to moderate this important panel discussion. Right, so in fact, we have a series of questions to ask them, and this is how it's going to go. We have questions for our panelists. From there's some few technical questions that we will also throw to some few technical persons sitting as participants here. And then from there, we would have some few questions if you have, and you want to throw it at them. But this will also depend on the time. But before we proceed, I would like to ask a specific question to the youth person sitting here in our mix. That's Madam Margaret, right? Miss Margaret Imprim, yes, with the Youth Africa Organization. And in fact, today you've heard a lot about the SDGs and what have you. Now your question is, so what are the most effective ways to engage and empower the youth in achieving the health and health-related SDGs in Ghana?
Thank you very much. It's really a pleasure to be here. I always count it a privilege to be amongst everyone here. And I think for a long time ago, the issue of health, as most of our speakers mentioned, has really not been highlighted. But consider the fact that even now there is climate change that is amplifying every cross-cutting issue, including the health. It's something that has brought up the attention of many, and I'm really happy that you brought me as a youth to also speak from the side of the youth. So how the youth can be engaged. I think one thing that the youth do based on our passion is advocacy. And for most people, advocacy is done when there's the understanding of what is going on. And so I think one thing that our experts here can, educate you in terms of universities, in terms of basic high schools, secondary schools, also even on social media. I think it's important to let the youth understand what is at stake with regards to health and every cross-cutting issues that health applies. Because I'm glad it's not just health, but health-related SDGs. And you can see that even where there's hunger, there's health implication. Where there's poverty, there's health implication. When there's displacement, migration, there's health implication. And all of these things affect the youth because we are the majority of the population living in the country and even Africa and otherwise. And so it's important, one, to have the youth being educated on how to, understand these things and how to even use their voice to, share with other youth and even other people in their homes. And another thing is we see youth very much active in NGOs, volunteering and stuff, but unfortunately they are not able to place their how would I say, their strength, and if they are not really given the opportunities to keep building themselves and to keep, boosting their development skills, their knowledge, they are unable to do all of that. So that brings us to opportunities. What are the opportunities even in this area of health and health-related SDGs? Aside from education, are there any form of, fellowships, any form of volunteering that the youth can be a part of to see things for themselves? Because youth in the urban areas do not know what is going on with youth at the arid areas. And youth probably in more privileged areas will not know what's going on with youth at the slum if they're not part of organizations and communities that are actually seeing these things and helping these communities. So I think one thing is that our organizations, our government, our development partners could do is to bring the youth in with regards giving them opportunities to be a part of the solution. Because whether we like it or not, most of the innovative solutions come from the youth. And so if they don't see things for themselves, they are unable to even show how to go about it. And even from the area of circular economy, which is one thing to help even reduce the issue of waste and its implication on health, we see lots of youth coming up with green jobs, coming up with recycling innovations, very much creative things that help reduce the waste. So if they don't see things for themselves, they might not be able to even think of these ideas. So it's important to bring them on board in terms of opportunities. And lastly, I would say finance. Most people have the knowledge to do things, and I've seen some for myself with regards to organizations to be engaged with. Unfortunately, one of the things that has been their issue has been the finance, because even getting the machines to even work with, you have to import them, and it's very expensive. And that's one thing that prevents people from even having their own means of solutions, because they don't have the funds for it. So I think one thing is finance. And the last thing I would say is indigenous knowledge is something that the youth is slowly getting away from, because they are not involved in what has existed in times past. And that's because, yes, there's modernization, there's digitalization, but there are some things that has been happening in times past, even with regards to health. There is burning of the orange peels to ward off mosquitoes. I don't know how many people in this present generation even know that something like that existed. So I think that there is the way of bringing the youth back to what existed and what worked. Or even if we could even merge the indigenous knowledge with even the modernization, because yes, there could be a loophole with what has been going wrong. So yeah, doing that would help.
Yeah, thank you. So what one thing would you request of government?
I think one is not enough.
No, just one thing that I think is very pressing, that you think that when, the youth are able to...
I think for government, it's more of inclusion. I think, unfortunately, we don't see much of inclusion. And I'm saying this as a CS representative. You don't see much inclusion going on. So I think where there's inclusion, there'll be opportunities, there'll be funding. So I think the inclusion is what I would say.
Great. So that's fine. I'm sure you've heard from the youth. So would you want to end by saying that, what is it saying that without us, nothing without us or something? I mean, do you want to re-echo that? Or you forgot it? Yeah.
Well, I think what I can say is each one of us here has a generation we are related with, whether a child, a son, a daughter, a grandson, a granddaughter, a niece, nephew, and no matter what we will try to do, these people would engage with other youth elsewhere. And so you cannot try to safeguard your little home, forgetting that there is a broader network of youth that depend on each other directly and indirectly. And so whatever you do, just know that every youth is connected. And if you don't build the youth next door, the youth will harm the youth in your room.
Right. Thank you so much. Can you give a round of applause? Right. So can you hand the mic over to the gentleman seated on your left-hand side? Yes. So being a person from the Ghana Federation of Disability Organization, I just want to find out from you. You know, we were all present when the COVID-19 hit. So the question is, how do you think COVID-19 pandemic affected, your progress, Ghana's progress, disability community's progress, in addressing, health and health-related SDGs? Do you think that the COVID-19 have actually, brought some kind of stagnation in terms of our progress towards achieving our health policies in the country?
Thank you very much. Sorry. I am with the National Council on Persons with Disability, first of all. That's the State Agency for Disability Matters and Systemic Inclusion. And the GFD is the umbrella civil society organization for persons with disability. And as a state agency, we recognize how hard the COVID-19 hits the disability communities. When we talk of hitting persons with disability very hard, we could see that right from economic through to health. Why am I saying this? Most persons with disability are entrepreneurs. It's only few that you could see them in the formal sector. But then most persons with disability could find themselves being entrepreneurs. So now that there is COVID-19, there is restriction. You don't go out, you don't do this. Now, business now have to stay back home. They have to depend on the little that they have saved. After feeding on that little, now it is left with them to survive. And that is where we are going to talk about nutrition. And we know nutrition also affects health. Now, fast forward, if we want to even relate to health alone, we are looking at individuals with disability. There is a little stigmatization. Now there is COVID, and COVID have opened up or have wiped away the bridge that covers the stigmatization. Now it becomes a very big. So you're a person with disability. You can't see. You need someone to hold your hand to go somewhere. There is a restriction. You can't hear when you get to the hospital. There should be somebody to do interpretation for you. Now we are running on shift. That person is not on duty. You are a person with physical disability. There are lots of staircases, so when you get to the hospital, you have to be helped to go up staircase. There's no lifts. Now people are not ready to get closer because they feel COVID-19 even are more friendly to persons with disability than those who are not persons with disability. We look at all this and you could say that no. Now lives of persons with disability were going back. Was really hitting them hard. However, there were some few intervention which was not enough though, but then was given to persons with disability. But you could see that now the lives of persons with disability within the COVID period, let me say, went back. Apart from the health issues, let's talk of the ordinary sickness that you take to hospital, the malaria, and then the other things. Now, the malnutrition that persons with disability will go through. And when we talk of persons with disability, it ranges from children to adulthood. So disability is no respecter of any person. Again, there might be some persons with disability who might be pregnant during that time. How were they taken care of? So COVID-19 really affected all lives of persons with disability, all the aspects of life for persons with disability. I think COVID-19 really hit persons with disability so hard, so hard.
Thank you so much. We are grateful for those responses. Indeed, COVID-19 has actually devastated many houses, and indeed, we just heard from the Ghana Federation of Disability, the council rather, sharing their experiences as far as COVID-19 is concerned with respect to health and related SDGs. Now, I would want to move straight to the representative from the division of the Family Health Division of the Ghana Health Service. Now, so coming from the Family Health Division, I want to find out from you, how can Ghana promote inclusive economic growth to reduce the burden of high cost of living, and the effect on achieving the SDGs? Coming from a family, division, of course, you tell us, the cost of living, as far as, how do you think we're able to achieve the HHSDGs with respect to, your setup?
Thank you very much. And for those of us seated in this room, I first of all wanted to find out if there is anyone in this room who was not affected by COVID-19. You can just show by hand. Okay, if you are in this room and you were affected, show by hand. Thank you, because if I said you were not affected, then all hands will be down. So I've seen the hands. And the post-COVID era, COVID has hit us, and it has hit us for good. It hit us for good, no turning back. But I think one of the positive things that the health system and the health sector in Ghana, including all our players, came to realize in Ghana is how resilient the system is in fighting COVID. Because we were all ready, from the health service providers, from the policy makers, government involvement, down to the actors at the regional district and sub-district level. Everybody was up to the task. So that's where I want us to start from. That resilience we showed with the involvement of the private sector, the everyone on board approach to make sure that this common enemy was defeated. That is the mindset that should guide our actions as a people and as a country moving forward. And that's why we see COVID as not just a negative impact, but then leaving us with many positive ways of doing things differently. So we realized that even in our trainings, we were incorporating a lot of virtual means of holding our trainings, our funeral gatherings, everything. But then post-COVID era, how are we doing things? Almost everything has gone back to normal because we love the way we do our things. I believe that COVID shouldn't just be an era, but the lessons should take us through. And that is how we can begin to reduce expenditure or most of the things we do. You realize that even at the hospitals, during the COVID era, how were we seeing patients? We started consulting, teleconsultation was happening. And then when you go to the facilities, at the front of every facility, we had what we'll call the hand washing setup with the dryers and all that, which were being used. You went to every school, and it was there. Now we are beginning to see increases in the cases of diarrhea diseases. And why was it that during the COVID era, something as common as diarrhea disease was so low and it's beginning to come up. So when we talk about beating the economic hardships of our times, I believe that as individuals, we should look at, first of all, because today is focused on the health and health-related SDG, we should look at the lessons from COVID, how we changed our lifestyle, adapted and reduced our infections and the number of visits to the facility. Because I believe it starts with the individual, taking control of your health, and then learning the lessons to prevent common infections that wouldn't cause you or your family members to frequently visit the facility. So I believe that is one. The second aspect is moving to policy decision. I believe that not every disease can be prevented. Even if, as individuals, we listen to the messages on health awareness and reduce our visits to the facility, a few would fall through the cracks and still need to come to the facility for health services. We don't want people paying out of pocket and spending so much money when they fall sick of basic or common health conditions that will make them pay out of pocket and move them into what we call the catastrophic health expenditure, where people have to now go and sell their cloth and their cattle and all those things just to pay for health services. So we would urge that, looking at the National Health Insurance Policy, it's a very good policy. And so it should function well.
Thank you.
In terms of the medicine availability, providing accreditation for facilities that are very close to the people so that people can easily access service to cut down the cost. And I think the final one I would say is that nobody wants to spend too much. Yeah. Everybody wants to use the little amount of money to improve their life. Very, very important. And so I've mentioned the need for individuals to take care of their own health, the response from the policymakers in making medicines and access to medical services available. It is also very important that we should be able to promote services that enable people to do what we call the regular checkups. So in the Ghana Health Service, we are considering rolling out what we call a wellness program, because wealth is health. So if you are talking about preventing people from spending so much on health services, we are rolling out this program, a Ghana Health Service wellness program, where people can just walk in and ask for basic services like checking your blood pressure, checking your blood sugar. So that is something that is also coming. And I believe that we need the partners. The partners should come on board, because no country is spared when the other is suffering. The COVID lessons again. So we should get the partners to come in to support such innovative interventions to take health to the doorstep of the people. And so the question is, how can we ensure that there is inclusivity in making sure that the burden, the economic burden that we have, doesn't move people into catastrophic expenditures such that when they fall sick, they are going to die.
Thank you.
So these are the three common examples I can think of. And at the end of the day, we should feel that as individuals, we are responsible for our health. And in meeting the health and health-related SDGs, it's not like looking up to the government or anyone, but then look at yourself, how you yourself can contribute to meeting the SDGs.
Right, thank you very much.
Thank you.
You know, the last statement is quite debatable, but we'll leave it like that. Yeah, because, you know, I mean, of course, the government is putting many interventions just so, we are able to live in a very safe environment. Yeah. But I think there's more that the government needs to do. Yeah. And I'm happy you mentioned the wellness centers. We need to improve upon it, because indeed, it's not giving us the best as we want as a country. I know there are many interventions, including the network of parties. Mm-hmm. You know, recently I also heard that the National Health Insurance Board also announced that there is going to be
free
checkups. Yes, which I thought that's also very good. But let's see how it's going to roll out. I think there are many interventions that government has rolled out. Right. So thank you very much for those. Can you hand the mic to Madam from the Policy Planning and Monitoring Evaluation Division of the Ghana Health Service, right? Right. So from Ghana Health Service to under Ghana Health Service, but now to Policy Planning, Monitoring, Evaluation Division. Right. So your question is, or want to find out from me, what are the most pressing priorities? I mean, that you think we can do to accelerate progress towards attainment of the SDGs? Give us maybe some three.
Okay. Thank you very much for the question, and I want to appreciate Dr. Marion. She's my boss. So after she's spoken, I don't need to speak. And I also want to add my voice to my sister to say that it's a privilege to be here to contribute to this national discussion. And from the policy side, I think Ghana Health Service has introduced the NOP, the Network of Practice, which is supposed to ensure that all facilities in a particular community come together, pool resources together, have strategic management, governance, and also ensure that we achieve the UHC. It's true that we are lagging behind because we just have about barely 6 years to attain these targets. And if you look at the pace at which we are going, we may, just like in the morning it was reiterated, we need to speed up. But from the policy side, this is what Ghana Health Service is doing. So we are pushing all resources, building capacity, and currently we have even developed the guidelines for the network of practice. There's something that has been on my heart as I think about this country, and I think that sometimes we raise things so high that the common man on the street don't really understand and appreciate the issues we are discussing. So if you say SDGs, how can the woman at Mokola Market appreciate what we are talking about? At the end of the day, service delivery and implementation of interventions and policy does not rest on us. As for us, we understand issues, and sometimes we can make choices that can improve upon our health. But how do we break it down so that the average person in Ghana understands the issue and can put in certain basic things that will affect the person's health? For instance, let me give you an example that will shock you. Recently, a pastor of ours went to the US and he decided to spit by the roadside. And then the grandson said, "Grandpa, you are not supposed to spit on the floor." How did that little child came to that realization that this is a bad practice? How, as a country, have we put down certain basic things that, as children, we talk about youth, incorporating the youth into the various policies and decisions that we take? How do we have a set of maybe core things that every family is aware of, that simple things? And since we came here, we've been talking about money, 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 and all that. It's true that we need money to push the SDGs, but we don't need money to clean our cities. If we say that filth or how do you call it, certain practices such as throwing rubbish on the street, choking our gutters and all that, it's your responsibility. And we have a slogan that says that sanitation is your responsibility. So as a citizen of this country, you should make sure that your environment and your surroundings are clean. People will take certain steps, and it looks as if you asked the question, you said, what should the government do? We have trained ourselves to think that everything should be on the government. But I'm here to say that, to tell all Ghanaians that it should not rest on the government, but it should rest on us as individuals. Do we really love our country? Do we want to push our country forward? What are we doing as individuals to make sure that all these policies we are discussing are implemented? So that is from the social side. So then we come to the infrastructure bit. Sometimes we go to our hospitals, and it's a little bit sad because it's supposed to be a little heaven where people can go there and get some kind of comfort and some kind of healing back to their home so that they can be productive citizens. But we see that still infrastructures at the various levels, some of them we've done very well, but others we still need to inject some kind of capital into it. So this is my little thought on the question you just asked.
So thank you very much for those responses. And indeed, I mean, attitudinal change is definitely what we're talking about. We need to change attitude. We need to amend our attitude. You know, some of us have traveled, and I think many of us have traveled outside. What we see outside is quite different from when we come back to our, so we need that kind of, you know, change. Mindset change, so that we can be able to improve our country. Indeed, I agree with you. We don't need money for it. There are many things that we can do with that money. Now, so I move from policy to another, policy, but this one at the highest level. You know, if I just sit at the highest level of the country, and then they ensure at least things that we are doing are being monitored. I mean, they provide us with the indicators and everything to be able to achieve the SDGs. Now, so I have two questions for you now. So what international collaboration and global partnership are needed to achieve this? I mean, from where you sit, I mean, again, we are talking about partnership and, and then also resources. And then the second one, to add to that, which is related, is how can national collaboration, be fostered, to be able to achieve health and health-related SDGs? Bear in mind that some of us are aware that the SDG, your commission is trying to do an evaluation of the health, related, SDGs in the country. Thank you very much.
Thank you very much for the opportunity. Now, just to say, I'm not sure NDPC is necessarily the highest policy-making body in the country, but we do advise the President, Parliament, and on our own initiative, we make suggestions, policy suggestions, which Cabinet ultimately has that responsibility. So I just wanted to clarify that. But in terms of answering your first question, what international cooperation and global partnerships are needed to achieve the SDGs? There are a number that I can think of. The first one that comes to mind, obviously, is the technical assistance. It's something that we've done very well as a country. We've engaged with our various development partners over the years, and they've supported us for many years to provide technical assistance. And we've been able to address many of our key health issues. I can think of HIV/AIDS, I can think of malaria. Over the years, we've been able to come up with various forms of technologies and various tools to be able to address these problems. And going forward, that's something that we still need to do. For example, when it comes to breastfeeding, exclusive breastfeeding in the country, it's something that surprisingly we are not doing well at all. Only 50% of children are exclusively breastfed. And that is shocking, because even some of our neighbors in the sub-region who we often look down on are doing much better than us in that area. And perhaps we need to consider what these other countries are doing, whether it's South-South cooperation or looking at more internationally, what we can do to be able to get the right advice, to get our women, our mothers, to be able to exclusively breastfeed their children, because that is the foundation of our health. If we are not exclusively breastfed, I'm sure all of us know what the impacts that could be. Other forms of international cooperation that I can think of also are obviously financial support. I think most of the speakers before me have touched on the issue of financing in various forms. And obviously government cannot do everything. The private sector within Ghana cannot do everything because we are fiscally hampered. We are experiencing a number of macroeconomic challenges at the moment. So how can we harness the international community to assist us when it comes to supporting us financially? There are a lot of global finance mechanisms that are available. And just last week, I think one of our partners here was even at the World Health Assembly. And just being able to sign on to some of these commitments opens up many opportunities, especially for the health-related institutions in Ghana to be able to access these, whether it's the civil society organizations, whether it's government. We need to be able to tap into these. But of course, many of these is not just about getting these resources. It's about getting these resources to actually reach the people that matter. And I was having a discussion with Dr. Marian just before this, and unfortunately, sometimes these resources do come into the country, and before it reaches the community, 80% of the money has gone into various forms of administrative and other costs that end up limiting how much actually goes to the people on the ground. And this is a big challenge that we need to be able to address. When it comes to another form of international support, I touched on this a little bit. It has to do with knowledge sharing. I think there's a lot that we can do to help other countries, but there's also a lot that we can learn from other countries. Some countries had worse indicators even when the MDGs started, and yet right now they are better off than us. And I think the earlier speaker spoke about sanitation. For some reason, as a country, we just don't seem to be making any progress when it comes to sanitation. Somehow, we did very well during 2020 and 2021. We all knew it was important to wash our hands. We all knew it was important to minimize our contact with unclean environments, and yet we've retrogressed in that. How can we learn from other countries to not only change behavioral change, but to also ensure that we have the right infrastructure and the right services available to us? We need to assess our current models, especially when it comes to doing away with liquid waste, solid waste, because these have massive impacts on our health. Are the current models actually working for us? We need to learn from other countries and assess whether or not these are actually working. But also learning from other countries to see how their various health-related sectors are collaborating. In Ghana, how well are the health sector collaborating, for example, with the sanitation sector, with the agricultural sector? We have a lot of bodies, we have a lot of sectoral working groups that are supposedly helping us to collaborate, coordinate things better. And yet sometimes things are not improving. What could we learn perhaps from other countries to see that, to address some of these challenges? Should it always be, for example, a government-led initiative? Or should the communities or the civil society organizations be taking a much bigger role in some of these things? For example, if government is to come down to teach people about behavioral change, if we don't take care, many people will say that government is imposing on us. But if other partners get involved in this behavioral change agenda, for example, other countries have achieved much more with these kind of things, and maybe we need to consider this. With regards to your second question, I think that had to do with how can national collaboration be fostered to achieve health and health-related SDGs, if I'm right?
Yeah.
Of course, when it comes to collaboration, Ghana is doing very well when it comes to creating bodies that help institutions to coordinate, to collaborate, especially at the national level. We see so many. When it comes to the SDGs, for example, Dr. Eugene, I think, is gone, or Dr. Eugene Owusu, but there's the high-level ministerial committee, I think that is in the office of the president, that manages the SDGs overall in the country. At NDPC, we have another body known as the Implementation Coordinating Committee, and then there's also the Technical Committee. So these at the national level have been set up specifically to be multi-sectoral bodies that bring together the relevant stakeholders to help us address our SDGs. We even have a civil society platform when it comes to the SDGs. At the regional and the sub-regional level, we've encouraged the RCCs and the districts to integrate these these SDGs into their plans, into the operations. So we have these on paper, and yes, they do meet, they do collaborate, and going forward, that's something that we need to continue doing. Perhaps what we need to consider is how effectively these bodies are actually translating into effective implementation. Because coming together to talk about issues, identify challenges, and come up with solutions sometimes is the easy part. But it's the effective collaboration when it comes to implementation. When you have, for example, when the health sector realizes that to address malnutrition, for example, we need to collaborate more with the Ministry of Food and Agriculture, with the Ministry of Education. How well is that translating into the programming, the implementation on the ground? Another form of collaboration.
Yeah.
Okay, one more is policy alignment. I know the Ministry of Health, the health sector does very well in churning out policies. It's a very, very commendable thing that they are doing. Sometimes, however, at NDPC, we do realize that some policies are formulated without NDPC or even some other key stakeholders knowing that the policy is being formulated. And then you end up seeing policy duplications or policy conflicts. A very common one that I can give an example of is the issue of one district, one factory, one village, one dam. The idea of setting up a very commendable project, setting up water bodies in areas that are water constrained. When you do this, have you considered the possible effect of malaria because of the mosquito breeding nature of these things? when you set up these water bodies, do you put in the necessary marine or aquatic life that would eat the larvae to prevent malaria, mosquitoes breeding and then malaria spreading in these areas? Sometimes these kind of policies don't come together. And that's often because NDPC, that has the oversight role, doesn't even know some of these things are being formulated. And then you end up seeing a malaria policy from Ministry of Health, and then one village, one dam, and they are not speaking to each other. Much more needs to be done. And there are so many other examples of this. So policy alignment is very necessary if we want to achieve the SDGs, the health-related SDGs. And so I'll leave it at that.
Right. Thank you very much. I think you have actually nailed the issue, and we are most grateful for those interconnection. Indeed, multi-sectorial collaboration is very much important. I know that many ministries are doing same, but like you said, we normally have these structures, but sometimes its implementation becomes problematic. I know of the Ministry of Health, for instance. There is a multi-sectorial steering committee on NCDs, you know, but like you said, I mean, the functionality sometimes becomes a problem. I mean, we hope that we'll be able to, I mean, with this think tank, we'll be able to activate some of the things and ensure that at least we are also asking the right question and ensuring that this multi-sectorial, I mean, collaboration or, I mean, that has been set up in various ministries, especially those related to health, will be activated and then also working. Right, so having said that, I have two questions, but these questions, will I throw it to the audience, and then specifically to, let me get the name. Yes, so Dr. Thomas Pepra, Majekum, I'm told he's from the KNUST, and he would help us to respond to this question. How can Ghana, you know, balance economic development and environmental sustainability and climate resilience? This has to do with climate change. I'm told that he's a climate expert, so he'll be able to help us to digest, I mean, this question. So, over, if he's in our mix, can we see him? Yes. So thank you very much, and please, you can have the mic. Can somebody help him with the? Thank you for accepting to help us to respond to this question.
Thank you so much. When Prof. Doku said he has a surprise for me, I didn't know it was going to be like this surprise. Yes, but I'm sure most of us, those who go to church 31st night, you prayed for greater things. You want to get more, so meaning that we want to develop. And usually from the perspective of environmental science or environmental economics, when you have resources, we need to use them. And exploring your resources, it comes at a cost to the environment. For example, if you are mining your gold, you don't expect your environment to be the same. However, we expect that as you get resources from your mining or from your gold, the money or the returns from gold should be able to use to restore the environment to a certain level. For instance, if you start cutting down your trees, we know you are reducing your carbon sinks, which also have impact on climate change or the global climate. But how do we put in efforts so that we can have our gold, still reduce the impact on the environment to also save the climate? So one thing from one angle we can say is that, yes, of course, health is key when it comes to the other SDGs. For instance, the members talk about nutrition. If we destroy our farmlands, what happens? So some of the strategies I think we can put in place to balance some of these things are, one, research is key. Can we develop or can we research into maybe drought-resistant food varieties or maybe early growing crops, because we know that soil fertility will be impacted. So if we have crops, we know that the rainfall pattern will change. So instead of our usual maize, maybe maize will take 3 months. Can we have varieties that will take less? So that at the end of the day, though we are developing, we are also having resources to channel into research of food systems to promote health and also reduce the inequalities, especially on vulnerable groups. Again, one thing I can say is that, yes, of course, when some of these institutions are not formalized. For example, we all know the issue of illegal mining, and then the problems they are creating for the environment. And I think that if we have organized group or formalized group system, for example, maybe if it's mining, we have the mining companies, then we can link the activities to what they do, where maybe they are not taking good care of the environment as they are supposed to, then they pay a certain fine, which usually we say the polluter pays principle, so that the fine can be used to compensate for the harm on the environment and other vulnerable groups. I think there are a lot of, we have the cap and trade system, where, let's say, industries are emitting a lot of these greenhouse gases. If they are not regulating their activities, investing into energy efficient systems to reduce their impact, then some of these fines can be used to also, or can serve as motivating factor for other industries to do better. So I think we can look at it from these angles. I know Ghana, we have most of these policies. Sometimes the issue is enforcement. And I think it's one area we need to work hard at it. Thank you so much.
Thank you so much, Doctor, for helping us to respond to this question. Please, I hope you're having your questions ready, to the panelists and also to, those who are helping us to do some interventions. We have another question, and I'm told that then Dr. Emmanuel Boateng from the Statistical Survey Department will help us or do us the honors to, to respond to this. The question is, how can data gap be addressed in tracking progress towards the attainment of the health and health-related SDGs? So if it's now Miss, can we have him, respond to this question? Thank you very much, Doc.
Okay. Thank you. I might say that Ghana Statistical Service has always been coming out with data through our surveys and censuses to make sure that we have adequate, reliable indicators to track the SDG. Just last year, we came out with the DHS, and about 44 indicators were churned out. What we are seeing is that some of our surveys are not regular and timely. So the last one was done in 2014, and this one was 2022. So moving forward, we have to ensure that our surveys and censuses are regular and timely to provide the needed information or data to track this progress. And as a leader and the coordinator of the National Statistical System, we've also partnered with the MDAs. We've met with them. We've agreed on certain templates to collect administrative data, which is regular and very cheap, to help us supplement the censuses and surveys that we periodically undertake. And also all the 261 districts, we've collaborated with them to collect some information on certain thematic areas of our data so that we'll be able to complement with other sources of data that we are churning out. Again, we are also doing what we call small area estimation, that we are combining our censuses and our surveys information to go to the lowest level for disaggregation, at least to the district level, to make sure that we have data even at the district level. We are also looking at innovative ways of bringing data, exploring big data, citizens-generated data, and a whole lot of them that we are working on now to make sure that at every point in time we have data to track this SDG. Thank you.
Right. So thank you very much. Indeed, I know very well that because your work definitely aligns with the NDPC. One day we will definitely have a forum to see how, your work is properly aligned with the NDPC. Right. So thank you very much for those responses. Right. So now I go to the participants. Please, if you have any question, burning question you want to put to the panelists, please, you are welcome. Any comments also welcome. Thank you so much. I think I have an hand over there. Can you introduce yourself and your name? So from here we go to this table, and then we move to that table. Right. So
My name is Jeffrey Okansi from Revenue Mobilization Africa. To the extreme left, the gentleman from NDPC, I can understand why he was not accepting their policy lead. I want to say that it's because we've left it as National Development Planning Commission. It should be an authority on its own. I think that's what we should be doing right now as a country. So you take your place as in leading the generation of government policy so that we all follow through, develop it, and then rather look at it with a national lens, not a political lens like they are doing now. Now the next one is to Madam about financing. Before we talk about inadequate financing, let me humbly remind you that as we speak, the political expenditure has not changed. The expenditure at the Flagstaff House keep increasing. The MPs who shared the television sets and the radio sets after election, I will give them car loans. That's the problem. Next is that when we look at the expenditure, like I told you, Ghana is not a poor country. Nobody can convince me. Don't start it. Not a country that we can talk about Pualugu just yesterday. $12 million. And nobody is telling me anything good about it. Crowdale, $1 million. Add the ones that you know. The problem is corruption, wastage. In fact, not corruption, stealing. Stealing of the monies. So all this we are talking about will be funded. If the finances are in this country is not a poor country. Not a country that has gold, diamond, oil, add the rest. Just recently when we said we were going to clean energy, we found lithium. Tell me that country that has all this I'm talking about. Japan has none. But that's where they are. So your problem is wastage and stealing of national resources. That's what. And then on the issue of COVID, Madam, I disagree. Our government has no right to talk about suffering from COVID. When you look at what we received, right down from Heritage Fund to what the World Bank gave us, to what corporate Ghana contributed, and as I stand here, COVID levy is still on my neck. I'm speaking from the revenue angle. As I stand here, COVID levy is still live. Nobody's accounting to me. So let's talk about that, and then let's forget about the fact that there's no money. Frontier's deal is still on my mind. How a company was just germinated within weeks just because of COVID. So when COVID happened, when you and I were panicking, others were ready to steal. When we went to hide in the room, others were stealing. You remember the NADMO, the sharing of those goods and the monies that were wasted. So the truth of Ghana, as we discuss some of these wonderful things that we have to do about development, is that there's wastage, there's stealing, because that guy who stole the phone on the streets of Accra is called a thief. When it comes to the political class, it is misapplication, misappropriation. What do you call it again? That's what you have been doing.
Thank you.
You're stealing our money.
Thank you so much, Jeffrey. So can you just give to the gentleman, so we just move from that place, come this way. The gentleman behind him. Oh, you want to respond? Okay, so I think they want to first and respond, but let's have 2 or 3, then we'll come and respond, then we'll go back. So let's have.
Thank you so much. Just to add, my name is Christopher Agbega.
Yeah.
I'm with the Ghana NCD Alliance. I'm an advocate and peer trainer. Just to add quickly to what Jeffrey said. So during COVID, there were medications that persons with autoimmune conditions take on a regular. Hydroxychloroquine, if you remember, which sells for less than 100 cedis. I am a person living with a neurological condition, so I know a lot of people who take these medications. That medication within 2 weeks skyrocketed from somewhere around 70 cedis to 800 cedis. Now, when you look at the space in which we are, you ask yourself if there are ever regulations, if people are checked, if there is accountability, because there's a lot to learn from COVID. But it looks as though we just learn, shift it under some shelf, and then we are back to square one. So I completely agree. I was affected. I was heavily affected. I worked for the Ghana Federation of Disability Organizations at that point. So nationwide, I understood the fatigue that was going on within the disability space and the NCD space. So let's not generalize government's approach to solving COVID as though they were able to positively affect or impact every community, when you have certain communities that were not even consulted in the first place. And when we were going through these conditions, governments never attended to them. So you had pharmacies doing what they thought they could do to siphon money. So again, they were stealing, right? Because there was a loophole, and who was checking them? No one. But let me add to this. When you look at the SDGs and you look at the targets, you'd realize that universal health coverage is key to achieving even the SDG Goal 3 in general, right? But ask yourself, within the NCD space, what is the impact of the use of our national health insurance scheme when it comes to accessing health? It is still at its lowest. You have a lot of persons living with NCDs who don't even want to go and renew their health insurance cards because it has no impact. You still pay out of pocket. And when we are in meetings with the Ministry of Health and the Ghana Health Service, you see sort of a secular response where it's like shifting blame and nobody wants to take it upon themselves.
Thank you.
Finally, Blackman, please. Finally, before I hand over, in achieving health-related SDGs, a person-centered approach is important. Again, you see that gap where you have the youth and the disability represented on the panel. But when it comes to the implementation of some of governmental activities, you find out there's a gap. Meanwhile, there's a WHO framework on meaningful involvement, and you don't see that. Now look at mental health. How many times do we even talk about mental health? How many times do we even talk about how COVID and other health-related activities have impacted certain communities? So you see, again, I'm hearing generic responses. I'm hearing general responses like, yes, we've done this, that. You go for meetings and they are just numbers. And you look at whoever is speaking, whether it's a minister, and you're like, are you serious? Or is that because you are there and you can afford it, so it looks like everybody can? It is appalling.
Thank you very much, Christopher. I know what you went through during COVID, so I mean that's one note. Thank you so much. So we have the 3 questions. Then we'll come to if there are any responses, we get them. Then move to this side of the room.
Right. Thank you. My name is Ampuma Isaac, and I think the conversation has been very encouraging. I have questions for all 4 panelists. 5, but I have 4. But of course, any of you can pick it.
Okay.
And so the first one goes to the person who represented the young people. I want you to help me.
I don't think we have the time to take 4. If you can make it 2.
Right. So within the minute, I think I can move faster. What do you think is your contribution towards identifying youth-related health topics within the partnership engagement? I want you to stress on that. And also on family health. In the case of pandemic preparedness, you gave a lot of lessons. How do you expect us to fund that pandemic preparedness? And PPME, you talk about network of practice. How are you going to engage communities to understand what the network of practice is all about? Is it not going to be business as usual? What is that unique introduction? And maybe my brother from the disabled community, how can you also make your voice known so that when we are preparing policies, you are not left out? From NDPC, you recently launched Vision 2057. When is the start date?
Thank you, Ampuma. Can you give the mic to them if you want to respond? Can we make it briefly so at least we can have other years? So, brief response, please. Yeah.
Thank you. I will try to be brief. I'll try so much. So, so when it comes to policy, you are asking how our voice can be heard. We have the state agency called the National Council on persons with disabilities. And it is an agency with the Ministry of Gender, Children and Social Protection. However, it is a cross-cutting agency because we work with all ministries, departments, and agencies, as well as MMDAs, Metropolitan Municipal District Assemblies. So, for instance, when we go back to the COVID days, we were parts of the institutions that were mandated to share raw food items. And we did not gather people at a point. We were moving from home to home to give items, raw food items, to persons with disabilities. So when it comes to policy making, persons with disability are not left behind. Again, we are talking about issues. We see, we first of all made mention of private partnership. So there might be other things that individuals or private institutions are doing. There is a saying in Chi that one hand cannot cover the face of God. And that is what we are experiencing over here. So if there are issues and we don't table it to the institutions that are supposed to handle this, it will be very difficult to go with here and say. So it will be very appropriate when we have issues, for instance, when people decided to make, what do you call it, over profit in selling of items. If we have written to, let's say, Ministry of Health, the Ghana Health Service, or even the National Council on Persons with Disabilities, to state all these things so that government could take it on. We are talking about policy issues here. Again, now we are asking that identifying youth and COVID levy and those things. We all have all these issues coming up. But I want to say that when we are talking about identifying youth and then giving them programs, we all bear to the fact that when you look at the medium-term development plan that the NDPC did, they have targeted groups, which in those targeted groups, they never take away youth. And one key role that played out throughout the medium policy was the inclusion aspect. And here, I'm going to be positive biased towards persons with disabilities.
Yeah, can you be wrapping up here?
Okay. So we have so much, and we think politicians are stealing and those things. But to touch a little on that, yes, we might call it stealing and whatever view. But in addressing the questions that we asked here, the panelists, we all heard of us talking about attitudinal change. And attitudinal change is not just for other politicians. We, even those at the down there, what do? We want to help our brother. That even establishes the Guru boys. So somebody knows somebody wants to do passport, and the passport is, let's say, 50 pesos. But we, the one establishing to help the people, wants to take 1 cedi 50 pesos. So it all boils down to attitudinal change. Because now our politicians there, yes, death is inevitable. They might go. And then maybe in future, I will have the opportunity to be a politician. What kind of attitude am I taking up there? Thank you.
Thank you so much. Can you give the mic to our youth representative?
Thank you very much. So
briefly, please.
Yes. I think one thing that you can use to identify youth-related health issues is looking at the socio-economic development, particularly everywhere you go to. And as someone who have engaged with youth from different contexts, different cultures, global north, global south, we realize that the youth in the global south, due to the insufficient resources, have a different kind of need and different kind of issues that are related with them. For instance, with Ghana, because there really isn't many jobs, there really isn't a lot of the basic needs, as you see in the Abraham Maslow's theory, the basic need, food, shelter, and stuff. you realize that people's health-related issues are peculiar to that. You see people trying to find jobs, trying to see what they can do to get jobs, to get food and stuff. So already there is stress and the stress-related health issues. Now, looking at climate change coming in, it has more or less like amplified the whole thing. So you can imagine someone who is maybe in his or her 30s, the burden on the family because maybe the parents are aged and so they cannot do that. So that person is now supposed to do more things to get whatever they need to get. And imagine such a person living in the coastal area and with the whole rise in sea level, now the person is displaced. Now this person who maybe had a home now has to move somewhere else to look for a place to stay and even take care of his or her dependents.
Right.
So that also is one thing. So looking at the socio-economic issues and climate change, Ghana, unfortunately, we do not have that luxury of saying that the youth don't have needs. Already, without climate change, there were needs.
Thank you.
With climate change now, there are more needs.
Thank you so much.
Thanks
so much. I can have the mic. If you can do.
I can see you're really.
We are
So
pressed
for me,
for time.
the first I would say is that when you write your question down, ask yourself again if you have a contribution or a solution to that question to share with us. Because I believe everyone in this room is a think tank. So if when you have the solution, don't think because you have to ask a question, you should find a question and ask. It's also important. So I'll quickly say that for me, as a director of family, when I meet my team every Monday morning, today I couldn't be there because of this meeting. We always look at, take a moment, who is your immediate boss? Then you find your next immediate boss, up and up. And when I do mine, I realize that mine goes to Director General and then the minister. Then I find out who is my boss's boss, because every boss has a boss. They need to go to the president. Who is the president's boss? They need to go to the people of Ghana to come back to us. And so we always tell ourselves that whatever we do, it's for the people that we are working for. It's very, very important that we should appreciate that this SDGs, all the high-level policy decisions and meetings we are having, is for the people. And most of the data that my brother mentioned that they are collecting to guide our progress and our efforts is generated from the bottom up. That is where it's coming from. And if the data is coming from the bottom, if the data is good, it will show we are doing well. If it's bad, it wouldn't show. So let's look at the low-hanging fruits that we can pick and then solve. And then when it comes to funding for public health response, we have what we call the public health emergency response teams. These teams start from the national, we have the national planning team, but then at the regional level we have it, at the district level we have it. And we have the community health management teams in every community, they have it. And these are the people who hold the meetings, and it's there and it's activated when an epidemic comes. So that is why we don't need so much money. We don't need so much money to keep the teams active. But when there's an epidemic and more meetings are called, they'll definitely need a little bit of support. For funding, government mainly takes care of the staff remuneration because all the health workers you see is government who pays them. Some of them function 24 hours, and in the night shift, they can attend to just one pregnant woman. But for us, if one woman delivers safely and 8 health workers attended to her, we still count it as gain and not loss. And so we should look at how the private sector can come in to support services as we did in the COVID era, and how corporates can also come in to support and make the NHIE strong. Quick one on the NHIE. You see, Ghana, we have one of the best health systems. As for Ghana Health Service, when we meet and you blast us, we take it, but we know the work we are doing, including providing services to the doorstep of women using our community health workers and the volunteers. We know. As a director, if you tell me that, what am I doing at the office, I will just smile because I know the efforts and the contributions. And it's for the people of Ghana. And that is all of us, what our mindset should work towards. Is really important. We should work towards harmonizing policy. That's really important. My division handles nutrition. But how many of us will go to lunch and feel comfortable eating the vegetables which will be provided raw? In the streets, will they find it? No. Who is checking that the food at the streets is well? We should work together I should identify this and work together to see how we harmonize the policy and avoid duplicating efforts. That will help us to also cut down on the cost.
Thank you very much. I know people will be itching to speak more, but we'll end it here. Madam, can you just give responses?
Okay, I think Dr. Marion,
quickly, yes.
Dr. Marion has answered the question, but I want to say that we are in this room not to talk about the past, but we are here to talk about how we can move the country forward in achieving the SDGs. We know politicians and all that they do, but for me, I think that as a person, I have a responsibility towards the development of this country, and I have to turn the challenges into something that will, in my own small corner, something that will move this country forward. I think we should move from where we talk about challenges, what this person is doing, that person is doing, and see from your perspective, what can you do to help this country? So my brother, it's not that I'm not aware that people are squandering money, wastage and all that. I am a reverend minister. So every time there's a challenge in the church, I don't even look at my general overseer. I look at myself and ask, how can I solve this problem?
Thank you.
So we need to have that mentality and change so that we move this country forward. We are all growing, and look at the state in which the country is now. Ghana
Thank you very much. And for response, you have anything? Yeah.
Thank you. So mine was a bit easy. When does implementation of Vision 2057 start? If you analyze the document very well, we did not specify a specific date. But if you were to ask me my personal opinion, the most likely time to start implementing it would either be 2025 or 2026. And I'll give you the reason why. 2025, because the budget will be read for 2025, will be read sometime in November. The budget processes to prepare the national budget usually start around April, May, June. A lot of things go on to determine the basket, the amount of money that will be available for the Ministry of Finance to allocate to the different ministries. So there would be room for 2025 for the Ministry of Finance to say that, okay, we're going to start putting money into certain areas that Vision 2057 has highlighted as priorities. But those engagements with Ministry of Finance and NDPC have not necessarily started yet. And going forward, we may still have room to be able to influence that. But why 2026 is most likely the starting date is because we already have medium-term plans that span 2022 to 2025. So the implementation of the current medium-term plans end next year, 2025. If we would want some sort of implementation to start 2025 that are aligned to Vision 2057, then these ministries and districts would have to adjust their plans to be able to meet this. So preparation of the next planning period, which is 2026 to 2029, is going to start, well, some work is already starting this year, but real planning will start early next year, 2025, for 2026. So definitely 2026, 2029 plans, you will see the clear link between the medium-term plan and the long-term perspective framework.
Thank you. Thank you so much for those responses. Right. So now we move to we have a quick question here. Then we move to Madam. I think we are done. So can we have the gentleman here? Okay, so you give Madam, let Madam ask a question. Yeah.
Thank you very much for the opportunity. I want to pick it from where my name is Anita Fafadate from UHAS. I want to pick it from where my brother left off with the issue of monitoring the system. In actual fact, we are talking about health and health-related SDGs. And what I'm concerned with is what we feed ourselves and our families. The chemicals. We are busily feeding our families with chemicals. It is becoming so much, too much, that the lands are being destroyed. We can't get simple food like cocoyam these days. And when you get some, it's very, very expensive. And let me say that that is the only authentic food you can get in Ghana today. Because the little chemical that touches it, the whole of that cocoyam gets destroyed. So if you want to eat good food, then start eating cocoyam.
Thank you. Thank you.
The other thing is the chemicals that are being used on the food. Let's say sometimes the food is almost ready before we spray the food item or the produce. Normally I ask, if I send a man to the market, will he buy the neatest cabbage, for instance, for me? If you are busily buying neatest cabbage in the market, it means you are killing your children with chemicals. If you don't see any dirt or worm or a sign that some of these parts has been eaten, it means it's not consumable. But who is getting the education to the people? The chemicals that are coming, all the adverts are busily saying the little you use, it destroys the weeds quickly. Yeah. That means that a lot of our organs in the systems are equally being destroyed. Especially when you take the chemical. There are parts that you can see colors. And the colors indicate which organ is being destroyed when you use it. And our farmers are not educated. They just pour and say, I can ask the caretaker of my farmer and say, oh, Tio no nimshe, more yields, I would say. So these are who is monitoring? Today, tomato is very expensive, and people eat food from the joints and their tummies are aching. They are running. We are talking about health here, for goodness sake. Please, let those in charge know that they have work to do.
Thank you.
Thank you.
Thank you so much. So we have here, then, wow.
Okay, thank you very much.
Yeah, I think that we need to be wrapping up. Okay, so
yes. My name is Adam Sebeneza. Yeah. I'm a rehab professional anyway, and also the vice chairman for the Ghana NCD Alliance. My question goes to Margaret. You know, there's no qualms about it that, of course, youth actually will contribute in attainment of the SDGs. It's very clear. But my question is, does the youth, I mean you are representing the youth voices, see the SDG as an opportunity to build capacity, advance knowledge, and also take opportunity? For instance, SDG Goal 9 talks about innovation, infrastructure, of course, industry. I attended, of course, ITU Summit in Geneva as a rehabilitation professional. You know, I saw the kind of zeal, commitment among those in the South, of course, and the North, what they've actually built. Innovative way of supporting, of course, those with physical disability and the likes. So do you see this as an opportunity for the youth to actually be involved and also take hold of that opportunity that exists? Yeah, thank you.
Can you give that briefly? I think we'll just wrap up on that here, so that Liz. Yeah, because of time, so please, can we...
So yes, so what I'll say is it's supposed to be a guide. I mean, we have even the goals, we have the targets. Unfortunately, for all of these 17 SDGs, there are priorities for every country and every sector. So the Global North will focus more on digitalization and other things because they don't have issues with food and stuff. We cannot even look at that one first because we haven't even finished tackling issues with poverty and hunger and quality education and all of those things. So yes, it's supposed to be a guide, and ideally every country is supposed to have that attainment for all the 17 goals. But the truth is we cannot attain all the 17 equally. There will be that priority. And the question is, where are we in Ghana? Can we even look at technology before even looking at how to educate even the tiniest person in their home, or make sure that everyone has good access to education and access to health and having good quality, you know, infrastructure, sanitation and stuff? You cannot look at you cannot ignore that and start looking at other things. So I think that's the concern in Ghana. We're just hoping that before we get 2030, at least we would be at where the global north is. Else, unfortunately, there will always be a disparity.
Right. So thank you very much for those responses. I think because of time, but I think somebody's protesting. He's even standing. Right. Yeah. So please, you can see the panelists, and then probably ask them the questions. So please, we would like to thank our panel members for helping us to respond to some of the key questions. And so thank you very much. I think you can resume your seat and then give them a round of applause. Right, so thank you very much for you want us to take a picture? Okay, so maybe we'll do that afterward, right? So thank you very much for those responses, and thank you so much for the questions that have come. Indeed, I've taken one cue from what has been said, the fact that we should, as much as possible, try to also, come out with solutions, when we rise up to ask questions. And indeed, this is something that I think that we have to let it also reflect in our questions as we move along. Right, so the next on our agenda is the inauguration of the think tank. So I would beg of you to allow me to mention the names of the think tank members, and then we would have the chairperson to do us the honors by officially unveiling. A minute. So I'd like to call on stage. Oh, sorry. Yes, I'd like to call on stage the number one on my list. That's Dr. Please, if you can just line up like this for me, so at least we can have you, unveil. Right, so we have Dr. Opari Jan from the National Development Planning Commission. Can you give them a round of applause? Yes, so you can stand there. And then we have Mrs. Vera Kakari Bediaku with the Gender Department, Ministry of Gender, Children and Social Protection. We have Mrs. Dede Abina Bedu Edu from the Ghana Monitoring and Evaluation Forum. We have here Miss Margaret Imprim, also from the Ghana Green Youth Organization, Green African Youth Organization. Thank you. Mr. Peter Badimak, I hope I got it right, Yaro, from Basic Needs Ghana. Is he here? I saw him earlier, right? So, and then we also have lawyer Esther Ekua Jemfi with the Ghana National Council of Persons with Disabilities. Is she here with us? And then we also have Professor Frederick Atto Ama from the University of Cape Coast, the convener. I'm told he is on a travel mission. And then Dr. Emmanuel Niboy Kwashi from the University of Ghana. Is he here? Thank you. And we have Dr. Ati Singh, also from the Kwame Nkrumah University of Science and Technology. We also have here Dr. Vida Yakong, University for Development Studies, KNUST. Thank you for flying all the way from UDS, sorry. And then Mr. Eric Okra, United Nations Population Fund, UNFDP. And we have Mrs. Levlin K. Asiedu with the CSO's, Ghana CSO's platform on the SDGs. And we also have our secretary, Mrs. Irene Asamoah from the Ghana National Council of Persons with Disability. And then my own good self, Mr. Labran Musa Masaudu. Yes. So I joined them, and then I give the mic to
Thank you very much. I think it's been a productive morning, and I have the honor to declare that the health and health-related SDG think tank is now inaugurated.
Right, sure, right. So thank you very much I think I missed one person, that's Professor Doku. I'm sorry about that, and yes, I'm sorry about that. I shouldn't have done that, right? So I think the next on our agenda is I think we have one more thing on the agenda. Briefly, short remarks from the partners, and I'm told that the NDPC has you're speaking on the IBR, so there's no need for that. But if you have a quick intervention for a short remark from the NDPC, if they are here, to give a short remarks as partners. Yeah, short remarks, and then we also have another short remark from the Ghana Statistical Service. Then we'll go straight to the.
Thank you very much, and good afternoon to everybody. The National Development Planning Commission, as it was indicated earlier, is the authority responsible for planning. We are the central planning agency in the country. It is by law we are responsible, and as such we do that. But I think we do that on a three-tier front. I think we do that technically, politically, and legally. We do that on a three-tier front. The Commission has been preparing what we call the voluntary national review reports. We prepared on 2 occasions these reports on the SDGs. The health and health-related SDG think tank has also been inaugurated by the Commission. Well, I think together we jointly inaugurated it and had it formed. So the idea is that whatever will be done by the think tank will complement what we are doing already. It is to strengthen the data that we receive, we are able to report on, and we are able to also make some concrete decisions based on the information that we are going to churn out soon. So we are ready for the work, and we will do that together with all partners, and then we say, welcome to the team. Welcome, all of you.
Thank you so much for those short remarks. So we have a rep from the Ghana Statistical Services. If they are here, short remarks, please.
Thank you. I earlier indicated that we are the leader and the coordinator of all official statistics in the country. So we have to coordinate to bring all other statistics generating institutions together to make sure that we come up with reliable and adequate data to monitor the SDG. And GSS have been instrumental in ensuring that we have adequate data through our censuses and surveys. Last year, as I said, we brought the DHS. Next year, we are going to do multiple indicator cluster survey, which we call mix, to also which is health-related data to augment what we have already. And there are a number of things that we've done to bring all the MDAs together. We have a common template that we are using to generate data, and the small area estimation, another innovative way to come out with data. So we want to assure the think tank that we are going to be there for them to come out with any needed data to help us chart the progress of Ghana in the area of health and health-related indicators. Thank you.
Thank you. Thank you so much for those ones as well. I think that we are right. So thank you. I'm not sure. I mean, what this note means, but I think that since I have the mic, I would go straight to what the program is telling us to proceed with. And but before that, I would like to okay. So let me just invite the chairperson of this event, and Dr. Joan Emmanuel De West, the Chief of Health and Nutrition at the UNICEF, to give us his closing remarks. Can you give that? Can you give it?
Thank you. Thank you very much. I think it's been really a very, very interesting discussion today. I think we all know the topic of SDGs. I think we have very clear ideas of what needs to be done. There's a lot of work that is still needed. I have noted 4 domains or 4 themes that came repeatedly in the discussions today. The first one is the need to accelerate. Acceleration would be the first one. The second one would be financing. The third one would be climate change. And the fourth one is about personal responsibility beyond what the government can do. There were other topics, but I think these 4 came from various participants and also through some of the questions. So let me start with the financing bit. So someone mentioned that the expenditure for healthcare is not increasing in Ghana. And indeed, that's true. The current share of GDP that is invested in healthcare in Ghana is 2%. So that's quite low. It's lower than the average of low and middle income countries, which is 2.6%. And it's lower than other regions of the world. For example, in Europe, they invest 9% of their GDP in healthcare. 2% is very low. Healthcare is very expensive. And we are facing a lot of changes. We discussed about climate change. Climate change is a massive change. It will have a massive impact on the health of the people of Ghana and across the world. The second one is environmental change. It's been mentioned several times. The impact of pollution, mining, but also recycling of car batteries, for example, and other things. So that's another change that is really, really important. If you have environmental change, it can contaminate the food production, and in the end you can have serious impacts. The third big change is what we call the epidemiological transition from infectious diseases to non-communicable diseases. Non-communicable diseases are chronic in nature. They are very expensive because unlike an infectious disease that you can treat in 5 or 7 days, non-communicable diseases, require sometimes lifelong treatment, which are very expensive. So in light of these three massive changes, climate change, environmental change, epidemiological transition, we also need to change how much money we spend in healthcare. We cannot continue with 2% of GDP because it's impossible to imagine how we can accelerate the progression towards achieving SDG goals if we don't allocate more financing for health and for nutrition. Let me give you also another thought about preventive care. So when resources are scarce, it's very important to invest in preventive care because preventive care is cheaper. There are different ways of doing preventive care. One of the most well-known measures is vaccination, immunization. So you know that Ghana is transitioning out of Gavi co-financing. So by 2030, Ghana will have to pay the entire cost of vaccines. And so this is something very important, and we should really pay attention about how we finance vaccines. This year we are facing delays in the vaccine payments. As UNICEF, we supply vaccines. We should have received the full payment for 2024 in March, and we have received only 5 million out of the 28 million that we were expecting from the government. So this is a massive issue. It's related to financing, it's related to preventive care, and so we need to think how we can address those issues. Then going back to the global topic of the day, which is collaboration, I think the contribution from Mr. Ni from the NDPC was really important. He mentioned two important areas of collaboration. The first one is international collaboration. He mentioned that in other countries, for example, in terms of breastfeeding, other countries achieve better rates than we achieve here in Ghana. So he was suggesting that South-South collaboration is really important, and I think for a think tank like HHSDG, this is something we should try to think about how you can use South-South collaboration for advocacy and influencing what's happening in Ghana. Mr. Ni also mentioned collaboration in Ghana, so he mentioned all the initiatives and policies that are set to help avoiding duplication, and the NDPC is playing a major role in that. So I think here again, there is a question about how those bodies translate into effective implementation. And again, for a think tank like HHSDG, is an important topic that you should probably work on. How do we translate all these initiatives at the policy and government level into concrete implementations in the field? That should include the private sector, but also, as it was mentioned, there is a room for personal responsibility. The government, of course, has a major role to play, private sector for sure. But several participants mentioned the important role of personal, individual responsibility, individual attitudes, individual behaviors, etc. This is important, but of course, in order to do that, the public needs to get the right information. So I think they need to be informed to do the right decisions. And this is, again, another area of work for your think tank. How do you encourage knowledge sharing and better education of the public for helping progressing towards the health-related SDGs? So this is it for me. I think these are the main closing remarks that I wanted to share with you. Thank you very much.
Thank you so much for accepting to chair and then also giving us the special closing remarks. So we'd like to end the meeting, but of course, we need to show some appreciation to persons that are in our mix today. So I would like to call upon Madam Levlin Asiedu, to give us the special vote of thanks.
Good afternoon, all gathered here once again, and Please pardon me to listen to my voice for the next few minutes to say thank you to all of you for joining us today in inaugurating the HHSDG think tank for Ghana, working in partnership with policy and science to achieve sustainable development by 2030. On behalf of the chairperson, on behalf of the team members, I would want to express our profound appreciation to our chairperson today, Dr. Juan Emmanuel Dewes. Thank you very much for being here with us. I think the clap will be bigger. Yes, we appreciate your leadership and then your role in inaugurating this committee, and we want to assure you that your recommendations are very well noted. We'll work in partnership, and then we'll learn and we'll share our lessons. And to our invited guests, all protocols duly observed, I would want to, on behalf of the team, also thank you so much for responding to our invitation. We couldn't have had a beautiful program without you. Your input, your presence have been very well noticed, and we thank you for the important contributions you have made to the discussion today. I want to especially acknowledge Emerita Professor Isabel Kwache, the Foundation Dean of the School of Public Health, University of Ghana, a proud member of University of Ghana, myself, School of Public Health. And she is the Vice President for the Ghana Academy of Art and Sciences. Thank you, Emerita Professor, for being here with us. And to all of us coming from far and near, from the ministries, departments, and agencies, thank you for being here with us today. Our media persons, people from academia, and civil society as well, and our media partners, we thank you. Beyond here, we are going to call on you individually at your offices and in your capacities as whoever you are to support the achievement of sustainable development. Please keep your doors open to us and to our handsome moderator for today, Mr. Labra Musa Masawudu. Thank you very much for steering the affairs of today's occasion. Thank you, ladies and gentlemen.
Yes, thank you very much, Levelin, for giving us a vote of thanks here. So I would like us to also invite Reverend Mrs. Sophia Kisiwa to give us the closing prayer.
Shall we be upstanding whilst we take the closing prayer? Our Father and our God, we thank you for being with us since we started this program. We are grateful to you for your presence that has been with us. We've come this far because you have helped us. Father, we pray in the name of Jesus that we will not end at the discussion level, but each one of us will take an area, a challenge in the country, and begin to work on it. Father, we pray in the name of Jesus for the grace, the resources, the partnership, the coordination that we need. We thank you, Lord, because you have done it in Jesus' name. As we leave here, Father, take us safely to our various destinations. We bless you and honor you in Jesus' precious name. Amen.
Amen. Amen. Thank you very much. We've closed. Please, we'll use this door, not this one. Please use the door on my left. Then you pick your, how do you call, your packed lunch as you move out. So thank you very much, and we are grateful for your coming. Hopefully we'll reconnect. Bye-bye.
development goals.
Today's world, the primary promoters of social and economic transformation. So if there's any important goal of a social or national nature which is going to be successfully addressed, it can only be so if one can challenge the private sector to participate in the process of addressing the issue.
Also in this edition, Ghana Beyond Aid Charter Committee inaugurated by President Akufo-Addo to give substance to the Ghana Beyond Aid concept as promised during this year's May Day celebration in Kumasi.
We should give substance to the concept of the Ghana Beyond Aid, and to do it by proposing we should establish a charter which would set out the true meaning, purpose, and also the calendar of implementation that would allow us to reach our goal.
The Presidential Diary is brought to you by the Communications Directorate at the Presidency, and it starts right now.